Welcome to In Session, the North Carolina Healthcare Association's podcast where we dive deep into critical issues impacting hospitals, patients, and the overall health of our communities. Whether you're a legislator, policy advisor, or community leader, this series is designed to keep you informed about the challenges and opportunities in healthcare today. Here's your host, Doug Heron, Senior Vice President of Advocacy and Policy at the North Carolina Healthcare Association.
Lawmakers are making their way back to Raleigh for the start of the 2025 legislative long session. We anticipate a wide range of issues will be addressed to include enactment of a new state budget bill, in addition to substantial healthcare policy. With me today is Nicholle Karim, Vice President of Policy Development, Anthony Okunak, Vice President of Finance and Financial Policy, and Blair Burr, Director of State Government Relations. Together, we're going to set the scene on the political landscape considering the 2024 election and how things have shifted. Then we're going to talk about some of the association's legislative priorities, policy positions, and discuss the Healthcare Access and Stabilization Program, also known as HASP. Thank you for joining me today. Blair, give us the lay of the land now that the 24 elections are over, and what's new?
There are some interesting changes ahead for state government. After a long career spanning over 30 years as an elected official in North Carolina, Roy Cooper served as governor for the last 8 years and ultimately reached the constitutional limit of 2 consecutive terms. To succeed Governor Cooper, voters elected Josh Stein, who, like Cooper, is a former state senator and the sitting attorney general. Among the Council of State races, Jeff Jackson, also a former state senator and sitting U.S. congressman, won the race for Attorney General. Mike Causey retains his seat as Insurance Commissioner, and newcomer Brad Briner was elected Treasurer. In the General Assembly elections, the 50-member state Senate maintained its Republican supermajority. The 120-member House still has a safe Republican majority, but fell 1 seat short of maintaining its super, meaning that with only 71 Republicans in the House, bipartisan support will be required to override any legislation that is vetoed over the next 2 years. While there are a mix of old and new faces, fresh changes in House and Senate leadership are likely to influence a new status quo in Raleigh. NCHA and our members look forward to meeting with both new and returning leaders to be a resource and partner to advance our shared goals.
NCHA is looking forward to working with leaders in the healthcare space to focus on some of our top issues ranging from workplace safety to behavioral health, in addition to matters that are priorities for legislators.
Thank you for the insight, Blair. Now moving into a different topic on our radar, HASP. Anthony, can you start us off by giving us a top-level definition of HASP and what it entails?
Sure can. Thanks, Doug. So HASP is the acronym for the Healthcare Access and Stabilization Program. It's North Carolina's version of a federal program that is an essential component to Medicaid expansion because it allowed hospitals to fund the non-federal share of Medicaid expansion. So that was about $550 million. Hospitals are financing to ensure around 600,000 people get access to Medicaid healthcare coverage. So another big thing is HASP enables hospitals to continue providing essential care, particularly to our most vulnerable populations, ensuring access to critical services that are sometimes hard for a lot of hospitals to financially maintain. So those services usually include labor and delivery, behavioral health, and life-saving emergency treatments.
I think there are some misconceptions about HASP and how it's funded and how it's paid out. But first, we should highlight that Medicaid pays less than what it actually costs for hospitals to care for patients. Hospitals must make up the difference or they operate at a loss. How does HASP work to fill the gap?
It's a good question. I think the big background to have in all this is that Medicare and Medicaid have historically operated at a cost deficit. That's one of the big reasons I believe that you see rural and safety net hospitals that have high Medicare and Medicaid payer mix historically struggle. So what HAS does is it allows for higher Medicaid payments through increased funding from the federal government, resulting in hospitals getting payment closer to the cost of care, which helps stabilize our healthcare safety net. Another important factor to highlight in regards to HASP is that it's not new funds allocated by the state, so it's not impacting North Carolina's state budget to the negative at all. Hospitals finance this program by paying a tax to draw down federal funds. So it's solely funded through hospitals and the federal government to get those enhanced payments to fill the cost of care gap. I think what's also important to highlight in this is that the enhanced payments or reimbursement rate is based on actual claims and patient encounters. So essentially, it's a rate add-on. It's a formula that is determined by CMS. It is in their guidance. So it's a strict formula that's really focused on the Medicaid patients all of the hospitals in North Carolina serve.
Okay, so recently the NCHA board approved our proposed or now final legislative agenda for 2025, and HASP is towards the top of the list in terms of the things that we prioritize. How do you anticipate this is going to come up next session?
I think it will come up in various factors. I think obviously the legislator did hospitals a great favor in passing the original HASP legislation, and really North Carolina a great favor by expanding Medicaid and allowing HASP dollars to fund Medicaid expansion. I think it's a lot of dollars, so I would see the first thing being just legislators asking that we are receiving payments, making sure that it is stabilizing the safety net as they envisioned, and then making sure that hospitals are being accountable and properly taking care of their Medicaid patients. From the NCHA perspective, us along with the hospitals are telling our story on HASP, and we will continue to urge policymakers to support the CMS Medicaid advance payment and methodology to ensure the state's vulnerable population continues to receive the needed care. I think also moving forward in the session, legislators would just need to know that this program will continue to improve access to care and help sustain our safety net hospitals. I think the other big thing is really just urging our lawmakers and reminding them that this is an annual program. Hospitals need to apply for this program through a preprint annually. So that's essentially an annual application. And so what we request is that, our state work to get that annual submission completed timely, and that CMS would approve that timely so hospitals can receive their funds to continue to pay for Medicaid expansion and the vulnerable population of North Carolina.
Thanks for all that, Anthony. Nicholle, you and I have talked quite a bit about shifting the NCHA towards being a more solutions-based advocacy association. What are some of those big policy priorities we're working on next year that fit within that scope?
Thanks, Doug. Well, there's definitely a lot to cover here. And as you said at the top of the podcast, we expect it to be a really busy healthcare policy session. So many items may come up that we'll be ready to address. But like you said, we have two policy areas that we are really focused on for 2025 that we'd love to have positive movement on. And both of those policy issues have to do with patients' access to healthcare in North Carolina. So the first is this growing national crisis of children that are waiting in emergency rooms. And sometimes they're waiting for days, weeks, and months for care that they need in their communities. And unfortunately, this is one of those things that I don't need to describe in too much detail because most everyone knows someone who's been through this experience, or they themselves have had to deal with this. And what we know about North Carolina is that for many of these children who are staying in North Carolina emergency rooms, a vast majority of them don't need hospital services. They need care in their communities, like a group home or outpatient behavioral health services. And unfortunately, they have nowhere else to go, and they end up staying in a hospital. And there are no simple solutions to this problem, but we do hope that we can continue to work with our legislators to help get families and children the care they need when they need it. The second priority issue we hope to work with lawmakers on this session is the growing concerns of patients accessing ongoing medical care after a hospitalization. So hospitals and health systems have this really unique perspective on access to care issues. When our providers, like nurses or doctors, are working in hospital settings, they oftentimes are helping people get connected to the care they need after a hospitalization. And they oftentimes run into barriers to be able to get that ongoing care, like a nursing home or like ongoing behavioral health care. And that's oftentimes due to limited provider networks, administrative hoops that folks may need to jump through, set by insurance companies, or just the prohibitive out-of-pocket costs that are passed down to the patient. And quite frankly, North Carolina has opportunities to improve protections for patients to ensure that their insurance coverage has a robust provider network and more transparency in how these decisions are made for if a service is covered by their insurance company. And we really want to be part of the solution to help make healthcare more affordable and accessible after that hospitalization.
Lots of great stuff to get into this session. And NCHA will continue working with legislators to find solutions and advance healthcare for all North Carolinians. Team, thank you again for joining me in this thoughtful discussion. We hope our listeners are leaving this with a better understanding of how some of these concepts work and how they impact healthcare in our state. Until next time, thank you for listening.